Hi, everybody. Welcome to No Doctor Just Healthy. And that's No Doctor Just Healthy on YouTube. And if you subscribe, you'll always be able to get the notifications of when I do post something. And I've got a whole list of things that I've already posted. They might be entertaining. But anyways, we'll see what happens. But here's today is a long video. I hope you enjoy every bit of it. But like I said, no doctor just healthy. But are you just getting older? Maybe that's the easy answer. And what I mean by that is that when I was going downhill, I was back around 70 years old, and I quit driving because I was panicking all the time, and I decided I didn't want to hurt anybody, and I was totally confused. I just couldn't function, and I get all my health care for free, so I could go get all I want, right? Well, when I would go for my health care, they would just say, well, that happens to older people. And so it goes on and on like that. And so when are you getting older, or maybe that's just the easy answer? And I think there's something more to it than that. It turns out that I don't know if you've ever asked doctors about nutrition very much, but they often will say that they don't get much training in nutrition, and and maybe that's because 30 years ago we didn't have all the insight that we've got on it now, because now there's all this investigative work going on all the time, and and a lot of things are really showing up. But anyways, I'll just go on, try to get through this, or cover all these areas. But this is a short summary of what I fixed in my own body, in my older body. And the thing about that is that it would be one thing after another. Like I worked in the VA hospital, and I would walk. I would get close to 10,000 steps during the workday, and it's not because that was the stress of the job. That was the high output of me. I used to really travel, and I would take in patients to their appointments and so on. So, anyways, my left hip started hurting, and at, I'll just say, like, after 5,000 steps, it was hurting enough to where I didn't want to add on any more steps. And I said, oh shoot, it aches. And anyways, I go to my doctor, not just one doctor. This is maybe two or three, because I fired two of them after I realized that they weren't really involved in my health. And so I went into the doctor and I said, doctor, I says, can you give me an appointment for a chiropractor? And she says, oh, we don't do that. And I said, well, actually, I got a message from the VA lately saying that you were going to do that. Oh, she says, I don't know anybody to send you to. And I said, so you don't want to pay for it? She said, no. I said, okay. And so I went out, and I had a Mustang GT hot rod, and I was driving that, and it started snowing out, and I had promised myself that I wouldn't drive it in the snow. And there was a promise. I broke the promise. I took off because I had to go back to the VA hospital. And even though I had a shuttle bus that I could ride, uh, I wanted to drive the car. And so I took off in the car and had an accident within a mile of my house. And I'm a great driver. It's just that I totally messed it up. And I spun out and went out into the traffic. And thank goodness it was just a big old truck, big old, not a semi, but a huge box truck hit me hard. Not my, and I'm sitting there in the car in my rear wheel. I don't know how it happened, but it ended up going past me down the highway. So evidently it went back up the highway somewhere, and then somebody else hit it. It went back down the highway. It went rolling right by. But anyways, I was it. I was done, and I was thinking, man, I'm messing up really bad. But anyways, my hip was okay. She said that my hip was old, was tired because I was old. I said there was something wrong with it. The accident, maybe the seatbelt, the way it was strapped on, tugged on that leg good enough to where it was fixed. Now here I am 6 years later, after firing her and all the other doctors, the hip is fine. it's just fine. And anyways, so see, there's maybe it's the easy answer. Like, yeah, I don't know. I don't want to figure out how to pay you for this. Because I'm a veteran. I get all that's part of our deal. We're supposed to get covered. Well, the VA doesn't seem to want to cover everything. And I don't think it's because they're saying no. I think it's because they don't know that they can fix things certain ways. Maybe. But anyway, let's keep going. Now, then here's a short summary of what I fixed in my old body. I guess I went over that. Confusion, mood, joint soreness, eyes. I said night vision because that's the most noticeable part. And dry eye, and gut health. I couldn't digest food. It was just awful. It was just awful. Doctor said, well, some old folks just don't do that really well, and or you got to change. You got to change over to eating um, oatmeal and I don't know what else, and grapes or something. No, I'm a meat eater. Um, Type 2 diabetes turned came in full fledged. I was pre-diabetic for years, and I didn't know what that meant. And I have years of destruction to my body because they only told me it was uh, pre-diabetes. To me, that just meant I didn't have diabetes yet. And some of you sitting out there are hearing that. You do have diabetes. If you don't work on it, it'll get into, I don't know what the difference between pre-diabetes and full-blown type 2 diabetes is, but neither one of them are any good for you. And it shocked me when my doctor said, oh, you've made it over the line. Your numbers are high enough to call you a type 2 diabetic. I says, wow. I says, I've been under your care for a few years, and now I have type 2 diabetic. Now I'm a type 2 diabetic. And that was pretty much the end of us. I didn't like her after that. We broke up that meeting, and I went home and I dug into correcting the diabetes myself. And 4 months later, she just wanted to see what was going on with me. I give her props for that, for caring that much. She called me back into the doctor's office, and I went in there and she did a blood test and all that stuff. And she said, your blood sugar is perfect. What did you do? I said, well, I says, I'll give you the really simple answer. This is, there's more, there's just certainly a lot more to this. But I quit feeding my sugar. There are no essential sugars. We don't need sugar. It's just that it tastes good. It also makes us sick, real sick. And my diabetes was gone, absolutely gone. She said, well, I got to take this off the, what do you call it? The diagnosis. You don't have a diagnosis of type 2 diabetes anymore. I said, okay, that's fine. Aren't you going to pat me on the back? She didn't want to talk to me. It's like I knew the secret. There's an awful lot of diabetics out there. And most of them are just eating metformin, and I can't think of all the different medicines that you take, but you take them all. And of course, they'll start working on your cholesterol at the same time. And if you're taking a statin, which I would talk myself out of taking, they should be giving you this also, CoQ10. this keeps the muscle in your heart healthy and or better, gives it a better chance of fighting off the medicine that they're giving you to fight off the cholesterol. And gosh, it's so twisted. It's all medicine, just really twisted. So okay, so and then my mood was I was really angry, and I was also it wasn't friendly, and I wasn't interested in doing correcting anything for a while, and um, it all happened. Well, the joint happened. The eyes, my night vision was so bad I wouldn't even go walking at night because I couldn't see the sidewalk. And you know how sidewalks, going through the grass, they got they're definitely a number of shades lighter. You can see them from the street light, the little light out there. I couldn't see that. It was black. It was pitch dark for me. My eyes are. I'm fine now. I drive a good car, and I drive it good, and I drive it all over the place, and I drive it in the middle of the night, and I've so far, knock on wood, I still miss deer when they run out in front of me. I'm really good at that. I drive it like a stock car. In the stock car world, when the car comes off of the rail and skids down in front of you, you don't try to race around in front of it. That's a for sure accident. You go towards their tail. You go towards where they're coming from, and you can miss a deer from that close if you turn your steering wheel the right way. And I've been lucky, and I hope I don't go out of here now and run into one. But it's okay. But that and the dry eye, I've worked on. Now, usually you're going to ask in the comments if you got a specific problem that you're really wondering about. But I'm just trying to tell you this counts. And like I said already, my type 2 diabetes is gone, and my gut health. I have trouble with my gut health, but I think what the problem is that it's not anywhere near as bad as what it used to be. Nowhere near it. I go to the bathroom sometimes, and if you think it's a gallbladder related issue, which I think it was, because I don't want to talk about poop. That's tacky sometimes, I think. But let's say, okay, here goes. I mean, this is real stuff. But if you have awkward movements, like you're everything isn't brown and solid and sunk in the water, then you're having a problem, and it could be gallbladder. But don't cut your gallbladder out. Don't do it. If you're set up for an appointment tomorrow morning, don't do it because you need your gallbladder. This stuff is a chemical that's in your gallbladder or in your liver that helps the now I'm going to start forgetting the words. It helps move the bile. Yay, bile. You need bile. And the bile goes to your gallbladder and hangs out there, and sometimes it gets thick, and sometimes there just isn't enough of it. Well, this stuff, for me, just about cured everything in the second dose. One pill one day, one pill the next day, and I was very proud of myself. And I've been using it every once in a while. Maybe my gallbladder is wore out, but I'm not going to cut it out because it's still okay. It's still decent. It's still working. But this is the kind of stuff the doctor just says, well, when you get old, that stuff happens. We take out a lot of gallbladders. No, don't do it to me. But this is the one that I got a big kick out of. Blood test results, all areas, improvements. Now, when I came into, I like to use that area from when I was about 70 years old. And I'm 78 now, you know, so the last 8 years have been like a rebirth of me. I ride an electric unicycle. I can run around the block. I don't run all the way. I run, they call it high intensity interval training. I'll run like a crazy maniac for only 30 seconds. Run just, if you're not wore out in 30 seconds, you're not running hard enough. You gotta run hard as you can. And I can do that. And then I stop. People clap their hands sometimes when they see me running. But and then you walk for a little bit, and your heart and everything it gets organized, and take off again. And man, that's one of the best. It's kind of like walking a lot, kind of, but it's really good for us. Good for us. Good for you. Good for me. And but I went to my doctor once a year. I go in at the VA to just get to basically to get the blood test. I don't have it. I don't share much complaints with anybody over there. But I got a new doctor, and I like this guy. He's a young guy, and I said something to him one day when he wanted to give me some cholesterol medicine. I said, no, 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 no problem. He's he kind of went like that, and it didn't bother me about it. And the next time I went back, I forget why I went back. No, can't remember why I went back. But he said, you know, your ratios are good. And that told me that he did some research. Because when you look at your ratios related to your cortisol, or not just cortisol, but oh gosh darn it, I'm starting to forget the words. But you're trying to say it out loud. But anyways, cholesterol, got it, cholesterol. And anyways, thank you, whoever said it out loud. Anyways, the cholesterol numbers aren't what we think they are. You got to do some research on cholesterol to figure this out. But my fat cells, the ones that are called triglycerides, they need to be lower because it means that you're carrying a lot of fat in your blood. Well, my numbers are non-existent. That doctor that I fired, she says, your triglycerides are low. I said, how low are they? She wouldn't give me a number. She said, they're significantly low. And I don't know, was it off the scale low? But anyways, they were gone, and that was from eating low carb, mostly meat, and low carb. And they try to say that meat is bad. Well, meat is bad if you add sugar to it, like the breading, gravy. That's all carbohydrates. If you add that carbohydrates to that, you have a salad with Kraft dressing. That's a big shot of sugar right there. So that makes the saturated fat act up. And it's not, if you don't eat that stuff, the saturated fat will be total energy for you, total power. And I think we kind of got through this. I'd like to add on, a lot more stuff, but you can certainly ask about any of this stuff. Like, like if you do have some neuropathy or some nerve problems, or your hands shake a little bit, look into this. Alpha-lipoic acid. So this is something that you can put that on a notepad and see if it sounds okay. But anyways, I'm done. That was a fun 20 minutes for me, and I'll post this now, and I hope I hear from some people. Thank you. No Doctor, Just Healthy on YouTube.